have your surrounding muscles being weakened, especially around the abdominal region or the upper abdominal, that is the chest region just above the diaphragm, and you find the muscles outside being weakened, and you now find a bulge appearing. That means the inner tissue pushing through the weakened muscles, thereby producing what looks like or a ball-like. Then there's every possibility we are looking at a particular type of hernia, but that will be confirmed by the medical personnel. Most hernias involve one of your abdominal organs pushing through one of the walls of your abdominal cavity. So that means once we have an weakened abdominal cavity, that is the muscles, and the inner organs now push through, you now find a swelling on the exterior part of the skin. Then you begin to suspect hernia. Now, there's reason for us in this class today to take something away. Why? Because in today's class, we are going to be afforded the opportunity of knowing the different types of hernias, the different types, outside the conventional one that you know. Let's start off by looking at the first one, inguinal hernia. Inguinal hernia. This particular one is very, very common. As a matter of fact, it is common in about 75% of, it's more prevalent when we look at the different types of hernias. This particular one, inguinal hernia, is more prevalent. It accounts for 75% of all the total hernias that can affect man. And this particular type of hernia is more common with men than with women. It does not mean that women do not have it. Women too do have inguinal hernia, but it is more common with men. Now, what is inguinal hernia? Inguinal hernia is a bulge. You remember I defined what hernia is. It's a bulge that capitalizes on weak skin surface. So you now find the inner content, the inner tissues or inner organs pushing through the weak surface. We will later get to see reasons why this can happen. So inguinal hernia is what we refer to as groin hernia. Groin hernia. Why? Because it appears around your groin. It appears around your groin. So another name for inguinal hernia is groin hernia. And I said it's very, very common with the men, though it still happens with the women. If you look at the diagram in front of you, you're going to see the structure of a human being, and you can see the exact position of the human body around the groin that this particular bulge is appearing. If you look at the interior of the bulge, you are going to find the small intestine pushing through the weak outer muscles, thereby giving you the ball-like future that you see around your thigh. Let's go and see some of the symptoms of inguinal hernia. One, a bulge will appear in your groin area. The patient will definitely feel pain or discomfort, especially when this patient is equally coughing at the same time. Sometimes when the patient is exercising, the patient feels pains around the groins. And sometimes when there are bowel movements, the patient feels these pains. Now, let's look at some of the causes of inguinal hernia. One, weakening of the abdominal muscles. So, weakening of the abdominal muscles is a cause. It's one of the predisposing causes. Now, we can have when somebody is aging, age too plays an important role in a patient having inguinal hernia. Now, an opening in the muzzle wall that should have closed before birth. So that means the patient may have had some level of deformity at birth. So you now find the muzzle walls that ought to have closed after birth or before birth still remains open. 5 years while growing, it still remains open. So you now find out that the patient, as the patient grows older, it is easier for the inner tissue to push through. Now, let's look at the second type of hernia. This particular type of hernia is known as a femoral hernia. Femoral hernia. Now, this particular type of hernia is very, very rare, but it is still common. Though rare, but it still happens to patients, especially with our female folks. We do see this type with them. Now, femoral hernia is equally another type of groin hernia. The only difference between these and the inguinal hernia is that this particular type, when you relax, the swelling goes down. It is only when the patient coughs, it's only when the patient, picks up something heavy, you now find this particular bulge coming out. So it is as painful as the first one. So this particular two types of hernia that I have mentioned, they are groin hernias, but the medical personnel can differentiate between the two. They can differentiate between the two. Now, this particular type of hernia too, we've seen it with children. So it is not just an adult thing. We've seen it also with children. Now, let's look at some of the symptoms of this particular type of hernia. One, you will definitely find a bulge in the upper thigh near the groin. Now, the patient will always complain of discomfort. Now, the patient will equally complain of abdominal pain, feeling of vomiting, and sometimes in some cases, you find the patient vomiting outrightly. Now, some of the predisposing causes are lifting of heavy things, obesity, when you strain, especially when you are urinating, or when the patient has an enlarged prostate. These are some of the predisposing causes of this femoral hernia. Let's look at the third one, hiatal hernia. Hiatal hernia. Now, this is another type of hernia. I'm sure as you are all listening, I'm sure you are shocked by the different types. I know a lot of you came into today's meeting with maybe one or two types that you know, but we're beginning to expose different types of hernia. So this is the third one, hiatal hernia, because of the stomach, when part of your stomach pushes through the diaphragm.
Off that fan, this one.
You have the diaphragm separating the upper chest region from the abdominal cavity, from the abdominal region. So when you now have your stomach pushing through the diaphragm, if you look at the diagram in front of you, you are going to see exactly how a normal stomach looks like, and a stomach with hiatal hernia. What has happened in the diagram that you're looking straight before you is that you now have part of the stomach muscles pushing through the diaphragm into the chest region. So you now find, if you look at the diagram to your right, you're going to see that swollen part above the diaphragm. So once you have that kind of swelling on top of the diaphragm, the medical doctors know that they are looking at another type of hernia known medically as hiatal hernia. Now, it happens a lot. Doctors have seen cases like this, so it is not rare at all. So I want us to look at the symptoms of this particular type of hernia, hiatal hernia. One, the patient would definitely feel heartburns. Now, the patient will equally have this feeling of taste of acid at the back of his mouth or her mouth, pain in the chest or the abdomen, pain when the patient is bending over or coughing or making an attempt to lift something heavy. You find the patient complaining severely. The patient with hiatal hernia will be complaining of difficulty in swallowing. Yes, dry cough have been observed. Some patients come out with bad breath. Some complain of feeling of vomiting, some vomiting outrightly, and some equally complain about having difficulty in breathing. So that is hiatal hernia for you. Now there are, we refer to the first one as sliding hiatal hernia, while the second one is parallel hernia. What is the medical doctors know it very well, but because we are doing a lecture for you people to understand it, it's not just we bringing you our super life product, but we're giving you super life product with understanding. Just like I did in my opening, we needed to educate this man that look, you don't take super life product when there's need for operation. You take it before as a preventive measure, then you take it when you're healing so that you heal fast, so that tomorrow you don't get another type. So that is how what we do week in, week out in this program. We educate. So sliding hiatal hernia is the one, is very common, is the most common type of hiatal hernia, where the stomach and esophagus slide up above the diaphragm, up to your chest region. Hello, just give me a minute. Now, the difference between sliding hiatal hernia from paraesophageal hernia is that for paraesophageal hernia, the content is moving, it's only the stomach that pushes up the diaphragm. Only the stomach pushes up the diaphragm. While for the other one, it's both the stomach and the esophagus that pushes up. So that's how the medical personnel differentiate between the two. The next type of hernia that we will be talking about is congenital diaphragmatic hernia. Congenital diaphragmatic hernia, CDH. Now, CDH is a birth defect. It's common with children. It's a birth defect that occurs when the diaphragm has an opening. So if you look at the diagram in front of you, we are seeing a normal anatomy of the diaphragm. Then you now see the second one, which is showing you clearly congenital diaphragmatic hernia. So because there is an opening, it allows for abdominal organs to move into the chest cavity. So once this happens, once this is observed by the doctors in a newborn or in a baby, they can easily identify this as CDH, that is congenital diaphragmatic hernia. So it is not just with the adults alone that we see hernia. Children too have it, even the ones that come out with birth defects, they have this particular problem. Hello, class, please, I don't know. I hope I'm not speaking to myself. Are you all hearing me? Are you all listening?
Yes, sir. I'm hearing you.
Yeah, go ahead.
Yes, doctor, we can hear you.
Yeah, thank you very much. So let's look at what are the causes. For CDH, it occurs when the diaphragm doesn't close during prenatal development. The medical doctors know this very well. It might be too much for you to take, but the medical personnel know this and they know how to correct it. A majority of the CDH occurs on the left side of the baby, to the left side of the body. So that is where it takes we often see it to the left side. So it can be corrected. Now, what can cause this? Underdeveloped lungs. Underdeveloped lungs can cause this while the baby is being formed. Breathing problems, high blood pressure in the lungs. High blood pressure in the lungs can cause this problem. Then smaller than expected lungs can cause this problem. Less developed blood vessels in the lungs can equally lead to this problem. So whichever the case may be, one good thing is that the medical personnel know how to handle this particular type of hernia with infants. Let's quickly look at the next one because of our time. The fan is still coming on board, and my brother Samson will still be speaking. Now, we have incisional hernia. Incisional hernia. Now, I'm sure a lot of us listening to this Zoom lecture today will be aware of this, especially mothers who probably have done, or men who have done operations in the past. Now, incisional hernia is an incisional bulge. It's a bulge that appears in the region of an incision. Why? Because an incision has been done, so that particular section that has been sutured by the medical doctors is weakened. Because it is weakened for several reasons, you now find the inner content of the abdomen pushing through the weakened muscle, thereby producing a bulge. Some of our mothers that went through cesarean sections, depending on the doctor that did it, you'll find, if you look at the section where that section was done, you find there's this bulge. Once you have this bulge right there, you are looking at incisional hernia. Yes. So an incisional hernia occurs when tissue protrudes through a former incision in your abdominal wall that weakened over time. So it is a common side effect of abdominal surgery. It is a common what? Side effect of abdominal surgery. So you find there are so many cases. This one we need not overflog it, because even those listening to me can attest to the fact that they can see this one, especially those who had carried out some surgical operations. Now, what are the symptoms? One, a bulge near the surgical incision. You experience pain or discomfort when straining or lifting something. You feel pain around that section of the the site of operation. You have this redness and burning sensation around that particular section. Then you have this feeling of constipation, and in some cases, nausea and vomiting. What can cause it? Just like I said earlier, an incompletely healed surgical wound can cause it. Excessive or premature physical activity after surgery. One, you find some people after surgery, they begin to engage in some physical activity when they are meant to have left the surgical site to have healed. They started too early engaging themselves in physical activity. So you are risking yourself to incisional hernia. Then some patients, significant weight gain can lead it. Pregnancy can equally make it appear. Increasing abdominal pressure can equally cause this particular type of hernia. Let's move on fast. The next one is umbilical hernia. Umbilical hernia, I'm sure a lot of you know this, where you find some patients, you see that section of your navel swollen. So an umbilical hernia occurs when part of your intestine pokes through an opening in your abdominal wall near your belly button, that is within your navel region. So most of this type happens from birth. I'm sure a lot of you must have seen lots of cases with umbilical hernia. Let's see some of the causes. In fetuses, the umbilical cord passes through a small opening in the abdominal muscles. Second, in babies, we see this in babies. The abdominal muscle may not close completely after birth. So that means after birth, that particular region does not close immediately. And when it does not close immediately, the intestines, the tissues around it push through it. And you now find that particular bulge appearing around the navel. Now, in some patients, we see when they become obese, that particular region equally can push, depending on whether the muscles around there have been weakened. What are the symptoms? A bulge or swelling near the belly button. The bulge may be more noticeable when the baby cries. So in children, when the baby cries and that particular navel region pushes forward and you see the place appearing swollen, but when the baby is quiet, you find the navel region becomes a bit calm. That place looks normal. So when you observe this in babies, we are just looking at that particular type of hernia. That's umbilical hernia. Now let's look at the next one. For ventral hernia is just a general term that the medical personnel use. I brought it up just for us to understand it. Why? Because for those who are medically inclined, they are very familiar with this term. Ventral hernia covers either the umbilical, is a term that covers the umbilical hernias as well as the incisional hernias, especially the one below the diaphragm. And the one above the diaphragm, that is around the chest region, is equally called, that's the epigastric hernia. So the three, the medical personnel might just generally refer to them as ventral hernia. So let's not waste time on that. Let's go straight to the next one, which is perineal hernia. Perineal hernia occurs when organs or tissues push through an opening or weakness in your pelvic floor. So here we are looking at the pelvic region. So there's another type of hernia that can take place there. Now, though it is rare, but it still happens. So we have some of the causes. One, they are congenital, some are acquired, some are primarily acquired, while some are secondarily acquired. So congenital, that means it is at birth. Acquired, that means a defect in the pelvic floor. So as the patient develops, you now find that muscles in that pelvic floor being weakened, and you now find the inner content pushing through. Primarily acquired, that means it is caused by increased intra-abdominal pressure. Secondarily acquired, it means it is caused by pelvic surgery that was done by medical personnel, and all of a sudden a bulge is appearing. So all of these hernias, as a matter of fact, we find them globally. So even in Nigeria, there's a high prevalence of hernias. We must not shy away from that fact. Around 54% in hernias were considered to be mostly right-sided inguinal hernias, 54%. Then we now have pockets of these other ones appearing with patients at different regions of our country. Globally, hernias prevalence is very, very high. The global prevalence of hernias has risen by 36% between 1990 to 2019 alone. So we have high incidence of hernia globally. So it is not something we should take for granted. So, and that is why we are doing this lecture week in, week out, in order to educate our people. And we are linking this up with our Super Life product so that you will best appreciate when and how to use the Super Life product, so that you'll be educated and be wise. At this juncture, I want to call on my farm brother, Farm Chilaka, to help us go through some of the diagnosis and tests for these different hernias that I have mentioned. And he too is going to throw more light in order to boost your understanding. So thank you very much, all of you, for listening. At this point, let me invite Fan Chilaka. Fan, please, are you there?
Yes, sir.
Thank you, sir.
All right. Good evening, everybody.
Good evening, sir.
Thank you, Prof, for the opportunity to be here this evening and the lecture we have received so far. Indeed, it has been very, very informative, and just to encourage us to take everything we do here very seriously and grab as much as we can, because even though you may not be a medical practitioner, you may not be a doctor, but it is important that you have this information. And so that in any case you find yourself in a situation where you also need to give a counsel or a guidance, you should be able to know one or two things to say. Also, when you also find yourself before a medical doctor, it is important you also know, what they are telling you to do and why they are saying so. Okay. In other parts of the world, when you visit the hospital, or when you are before the HCP, the healthcare provider, or the doctor, you do you know that you have rights? One of your rights as a patient is to ask the doctor, what he's diagnosing you for, what are his suspicions, and then if after diagnosis something was discovered, and then he needs to prescribe, you have every right to also ask, why are you prescribing this and that? Can you tell me what this drug will do? It's not enough to just collect the paper, go to the pharmacy, pick up the medication, and then you leave. It's not about 2 times daily, 3 times daily. No. You also it is your right to ask questions. And when you are in a platform like this, where, certain disease conditions are being highlighted and information, passed, it is to equip you, all right, to get you informed, so that in any case, whatever you are, you have an idea of what that subject is all about. You may not have the entire knowledge. Do you understand? You may not get the complete knowledge of it, but it's important that you have a peripheral knowledge so that you can also know how to ask the right questions. All right? So without wasting much time, let's look at diagnosis and the tests. How do we diagnose or test for hernia? And what are the possible solutions or treatment regimen, as the case may be? Well, just as doctor have highlighted, explaining all what hernia is and the various types of hernia, I would just want to give us a description, a pictorial description, even though I don't have any picture here. But I want you to use your imaginative skill to pick what I'm going to say now, so that you understand what doctor was saying earlier. Just to describe hernia, imagine yourself sitting on a newly purchased mattress. You have just gone to the market to buy a mattress, right? Maybe Vital foam or Bulkal foam. When you put that mattress in its position, maybe on your bed or on the floor, and you sit on it or you lie on it, you would notice that the cost is a new one, right? It's as though the mattress is able to withstand the depression from your bum bum. I mean, the pressure or the force from your body weight is being withstood, all right, by the mattress, such that there is the shape of the shape of your bum bum is not found on the mattress. In other words, it's as though you just sat on a wall or you sat on a stone. Not exactly a stone, but the point is you are not being able to really suppress the mattress. And that's because the textiles, the fabrics, and even the foam that has been used to design or make that mattress are still in their most potent form. All right? They are still very, very strong because you have just bought them, except it's a very fake one. But I am giving you an instance in a case where you have bought a proper mattress, maybe Vital Foam or Mocha Foam or any of those orthopedic foams, right? Now, fast forward 2 years, 3 years, 4 years, or 5 years later. If you sit on that same mattress, you observe something this time around. You observe that the mattress will have an inward depression. It's like it's invaginating inward. You know, when you sit down on top, when you sit down on top of the mattress, your nyash go press and go down. Now, it may not be all the parts of the mattress that you experience that. You are most likely going to experience that depression where at a position where you usually sit on. That's part of the mattress that you sit more often, or the part that is being used more often. You know, the particular place you are more likely going to be sitting down, or people will usually use, right? So when you sit on that part again, 5 years or 10 years later, you observe that the weight, or rather the tensile strength of that mattress may have depreciated. And so when you sit on it, you observe that there's a depression. Your weight will suppress or depress that of the mattress. And the shape of your bum bum will go down. If you are, of course, after some time, the mattress will come up and become normal. But you observe that a particular structure, a particular shape was formed because there was a depression, a suppression of the tensile strength of that mattress by the weight or force of you and your bum bum. I don't know if I made any sense to you. Now, that I have explained is just an analogy to actually give you an imaginative view, a pictorial view of what hernia is all about. Because when you understand what I've described, it will be easier for you to suggest solutions to that problem. Do you get what I'm talking about? Now, for hernia, just as Prof has described, your body inside and outside, all right, are arranged in muscles. You have bones, you have the skeleton. The skeleton combines with the skin, all right, and every other part of the organs through what we call muscles and tissues. These muscles are tissues, and the muscles are essential to enable proper binding and the movement of the body, both organs and every other part of the body. The reason why you are moving from place to place is not just because you have bones or you have legs. The reason why you can move and walk or use any part of your body for locomotion or a locomotive process is as a result of the presence of muscles. Muscles, what we call muscle. Muscles are tissues that are involved, that are essential in ensuring that there is a movement. And so, even within your body, there are also movements. As you eat food and all that, the food is moving from a place to place. There are muscular movements. So these organs
are built around muscles. The muscles are essential for you. If you put the food into your mouth and the food moves from your mouth, all right, down to your throat, that throat, there is what we call peristalsis. Peristalsis is a form of digestion that occurs around your esophageal region, all right, or esophagus. And what really happens there? There are muscles in your esophagus. As the food moves around that region, these muscles contract and constrict. They relax and contract. These two processes ensure that the food moves properly to the stomach and also ensures that the food is digested. Now, the same thing happens to your leg. This your leg, as you are moving about, has muscles. While I'm taking my time to explain muscles and what they do, is for us to understand what could have led to hernia. Now, the muscles that are also, you also have these muscles around, like I said, in every organ. So imagine your stomach, there are a lot of movements in your stomach, right under your skin, all right? You have muscles there to ensure that there's a proper movement. There's a movement of your food and particles from your stomach to your intestine. These movements are made possible by muscles. There are muscular contractions and relaxations that take place to ensure that there's a movement of particles, of molecules, of foods and substances within your system and even outside your system. You have muscles to ensure movement. Okay? Now, let's take this. Now, this movement, if the muscle, if any part of that organ or any muscle that supports the movement around that organ becomes weakened. Now, I said muscles are tissues. And to simplify it further, tissues are simply a collection of cells. Tissues are a collection of cells. So if I say muscle, I'm simply talking about certain cells that have been built up or arranged together to form that tissue. So the building blocks of muscles or tissues are what? Are cells. So if I am going to have a problem with my tissues, it simply means I'm having a problem with the cells. So let's take, for example, you have a fence. A fence. The fence of a building. That fence was not just carried from whatever place and brought to that place, all right, to form that fence. No, that fence was a product or is a product of blocks. The blocks are built or made from cement and sand. And so from the cement and sand, the blocks are made. So we bring blocks, several blocks together, bind them together, glue them together to form what we call that fence, right? Now, the same thing happens in your muscles. So the muscles are tissues. And how the tissues formed, we have cells that come together to form the muscle. So if there's a part of that, around that organ, whose muscles have become weakened, all right, it means that you will now have maybe the intestine or that part of the organ pressing that part, because that place that is just like I used the mattress analogy. That part that has been weakened, that is the part that will be depressed by the weight of that organ. So that organ, of course, contains various things, maybe food particles or whatever it is. It's usually around that region. So whatever region it is, if the muscles around that part or around that region are becoming weak or they are weakened, you will see that there will be a protrusion Protrusion means like an expulsion, like an extension, a depression of that organ or its tissues, all right, pressing that part of the muscle. And so you will now see it even externally. You will see it as if there's a growth, as if there is a bolus somewhere that is being stretched out. Why is it stretched out? Because the muscles or the tissues that are meant to withhold them so that they are not depressed have become weakened. Now, the muscles are also weakened because the cellular integrity of that place is being impacted. Something has gone wrong. If the integrity of the cell is intact, the tissues will not be weakened. And then if the tissues are not weakened, there won't be a protrusion of any kind. And if there's no protrusion of any kind, there's no hernia. So whatever method you want to use to solve this problem, if it is not going to target it from the very source where it started from, you are not going to solve that problem entirely. And so studies have shown that patients who had treated hernia, especially the ones that just use certain, when it's not really extended, over time, they tend to come down with some other kinds of hernia. And the reason is not far-fetched, because you need to deal with the problem from the root. All right? Okay, so I believe that is very straightforward. Now, how do the HCPs diagnose it? If you go to the hospital, how do they diagnose that? How do they know that this growth or this extension we are seeing here, this protrusion is actually hernia? Because it is not all the time that it is called hernia. And the doctor has taken his time to describe all various forms of hernias. And these types are based on the location where that protrusion is occurring. It's as simple as that, right? Now, if you go see a doctor and you begin to give your complaint, one of the complaints you want to give is that you're experiencing a pain around certain region where there has been a protrusion. Protrusion, I mean, is what we call like something they swear, something they come for, something they, if you like say something they drag from somewhere. Now, one of the things you complain about is pain. You want to ask, why is pain the commonest problem? It is as simple as that. Why? Because imagine you now, I come to you and I begin to drag, maybe I'm dragging that part of your abdomen. I'm dragging it. If I am dragging it, what you definitely observe, even if you're sleeping, if you are sleeping, fast asleep, and somebody comes to your house, comes to your room, and begin to drag your skin, after a while, you wake up because the pain, you feel it there that something has gone wrong. That is pain. So because there is a protrusion that shouldn't be, the signal you always get is pain. You will see it like a growth and you'll be feeling pain around that region, especially when maybe when you eat something. If you eat something or you carry a heavy thing, all right, you likely, because once you carry a heavy thing, what happens? There will not be so much pressure. And once the pressure is increased, what happens? There will be a higher protrusion or a higher depression. So once that place becomes more suppressed or depressed, you will sense it. The signal to give you will be a painful sensation. All right? And so when you are discussing with a doctor, and you say, I feel pain for the left part or the right part of my belly, the doctor will not tell you, can I see it? When he opens your dress or whatever it is, and he looks at it, he wants to take a close look, a physical examination of that thing, because it is visible. It's not a spiritual problem. It is very visible. Once there's a protrusion around any part of the body, you would know. It is very visible. So when he sees that protrusion, he will now touch it. When he touches it and you feel pain, say, is it painful? Say, yes, I'm feeling pain. Then cutting it, you will know what is in there. If it is a tumor or if it is an extension of an organ or organ tissues, you would know. Do you understand what I'm talking about? So there will be a physical examination to know if there's a protrusion. But again, because anything could cause that protrusion, you can have a growth that is not hernia. And so how would it now confirm that such growth is not is hernia or is not hernia? It's by running through. He has to do a scan. All right. Maybe a CT scan or MRI. CT scan is quite okay. With CT scan, you will see exactly what is inside that protruded part, that protrusion. You will see it clearly and would know that it is hernia or not. So once he does that, he knows what to do. Now, how do you not treat it? How do you not treat it? Again, it's a no-brainer. The cause is a protrusion, all right, that has resulted to certain tissues and cells being packed there. The simple thing to do is to open up that part and remove whatever thing that is there that shouldn't be there, and so that you can have a normal skin level. Do you understand what I'm talking about? All right. And so more often than not, you go through a surgical operation. So when the surgery is done, that thing is repaired. All right. Or sometimes you can do laparoscope. All right. If you do laparoscopy, it's just an invasive part. It is not just it's not like the normal surgery. This one is not as intense as the normal surgery. What it simply does is that it with the laparoscope you can view the very inside, the very inside of that part that is protruded, and it is marked and removed. All right. These are just basic ways of treating hernia. There is really it's not a big deal. It's not difficult to treat, especially when it is identified early enough. There are times where you don't even need surgery if it is not so. Excuse me, you're disturbing me. So if it's not so protruded, sometimes you can use certain molecules to just press it down and you'll be fine. Even sometimes the doctor could just use basic physiotherapy methods. He could just press that part. If it's not something serious, he can press that part, press it with his hand, and then there's a way they can press it and it becomes normal. It goes back to normal. It's only when it's quite intense, that you can have a surgery. Okay, now where does STC come in here? Where does Superlife come in here? Now, if you have listened to this discussion from the very beginning when I started, by now you'll be able to tell me what ways or what way would be the most effective in managing this situation. Now, even when you go through, because if there is a growth, if there is a major growth, there's a protrusion, you have to do surgery. It's as simple as that. However, after surgery, what's next? After surgery, what's next? We have seen cases where a patient has gone through a surgery today, and a few years later, they are coming for another one. So after surgery, what next? How do we now reinforce? Yes, there are medications that were given to you, painkillers and other medications to rebuild the integrity of that area. All right. But do they really solve the problem 100%? Because what you can actually do is to rebuild the cellular integrity. And then how do you build the cellular integrity? You have to find a way to get new cells there. How do you form the new cells? The only simple method, advanced technology or advanced natural method that's been used is the stem cell therapy. With the stem cell therapy, the body is able to regenerate itself. It has the ability to design cells that can proliferate to certain areas of interest, all right, and regenerate themselves. So it means that those weakened tissues that became weakened or weak as a result of inefficient cells, if I may use that, you will now have new efficient cells that will be resynthesized by the body by itself. The body is designed to rebuild itself naturally by itself. But you also need something to stir it up. So the stem cell therapy or the STC or the plant-based stem cell, the capacity it has is that it has a way of activating the body to naturally regenerate itself. And such that even when you have done the surgery, perhaps you have hernia and it requires surgery. Even when the surgery has been done, you also need post-surgery, you need to now take the STC. The STC would help you, especially the STC30, all right, will help you to regenerate those damaged cells so that the tissues can become strengthened again. And as such, there won't be a relapse or a repeat of that problem. I hope that is very clear enough. It is very, very straightforward. Very straightforward. And so nobody is saying don't do surgery. If of course surgery is a key way to take it out. You have to do the surgery, take it out, all right, and make that place flat again and make it normal. But how do you now ensure that there is no repeat? All right, that is where the stem cell, the plant-based stem cell or STC comes in, especially the STC30, the STC30, the STC30, because it has the capacity to rebuild the damaged cells. When the damaged cells are rebuilt, the tissue's integrity is reinforced. And when that is done, there is no longer any reason for hernia to come again. Thank you very much for this opportunity, and God bless you.
Thank you, Farmer Chilaka. Thank you. You really nailed it. Thank you, Dr. Rove, for the wonderful expository. Like I said at the beginning of the workshop, that this is a very, very informative workshop. It's not in any way to create fear, but knowledge is power. That's why this valuable information, if you take it home, possibly since we are most of these things we are uploading it on our YouTube page. That YouTube page is still open, is not monetized. You can go there, Super Life Lagos. If you just type Super Life Lagos, you will see the past workshops. Then I think any moment this one too will be there very soon. So even once you get it well, possibly you might never have hernia yourself, but being a watchman over your family, over your loved ones, over friends and neighbors, you can be a solution provider by this kind of pointing this to them. Even looking at it and say, it could be this. Okay, giving the person directives on what to do. Go to lab, go and check. Let's know what next. Before you know, that's one good thing about us. You can't come to us now and give me this. We want to know what is the case all about. What is your most recent results, whether scan results or whatever test result you have? Then we can link you to our consultants. We have so many of them online. Many people that are even outside the country we have been having a conference, private conference meeting with them. And you see them now following suit with today's topic that is on hernia, and we are talking about the plant-based stem cell therapy. You can see that is the foundational when it comes to health and wellness holistically. It lies on it. It lies on the cells. Any product that has the capacity to repair, to replicate, or to rejuvenate cells, that product carries life. That product carries life. That's why the adoption of WHO of these products is unparalleled. So I don't want to go too far, like a statement made in UAE, when a pharmacist were kind of trying to draw a conclusion about this. He said plant-based stem cell therapy, that's even though that he's a pharmacist, that if you put all the pharmaceutical drugs all over the world put together, that he can assure you might not come closer to the value of what we have today. And the biochemistry, whom God used in bringing this to the limelight, they have been in the pharmaceutical world for years before this secret was led to the scientist, Fred Zulli. Please take out time to verify this information. Take out time. Go to internet. Google biochemistry or Google plant-based stem cell therapy. It will link you to biochemistry. It will link you to Miracle Apple. It will link you to a whole lot of things. It will tell you about what biochemistry stood for years before this secret was given to them. And they completely focus on organic products, stem cell. For our holistic health, whether you are having eye challenges, whether you are having a brain issue, whether you are having spinal cord, whichever one, all of them, this product will empower your body. And our body will begin to do the natural work that God ordained it to do by healing itself. That is it, Cure ED. So I want to weigh in, please, in case if you have any question, go to the chat room because time is fast spent. Please, again, if you want to make use of our products, please identify with the company as a customer. Don't go and begin to patronize people that want to resell to you. I want to put it to us that anybody that wants to resell products to you, that person is not selling it, is not having a genuine product. He's trading with fake products. And I still have to make some submission again that our products till now in Nigeria, I don't even know any other country, is not allowed yet. We don't have any pharmacy that we have an MOU with. So if you see anything that looks like Super Life in any pharmacy as out of date, is not our product. You can only get our products directly from, we are 3 directors in Nigeria. My humble self, I reside in Lagos, but I can attend to you anywhere, wherever you are. We have an MOU with the GIG. They will deliver to your doorstep. We have Mama Africa in Abuja, though still not yet in business because she's bereaved. We have Esther Kombi in Benin City. So please feel free to ensure that you are getting the product. I can imagine. You can imagine if you are using your hard-earned money to buy fake products. I don't care to know how much is being sold to you, even if it is free and is a fake product. And this fake product, you are going to use it sublingually, is more dangerous, very dangerous. Please don't use your money to buy something that will complicate your health or even put someone to early grave. So that's why we have been making all this campaign. Even in September 7th last year, we gathered medical experts at Radisson Blu on the 7th of September last year with a lot of media houses that came on that day, just on a simple information that you and I should connect to the generators. It does not require much. It just requires your valid ID card, any of government licensed ID card, such as NIN or voter's card, or the driver's license or international passport. Any of them you have. Even if you say you don't have, it is easier to get NIN. We can assist you where you will get it, your own NIN, you register it. Then the next is a valid ID email address. Every other thing, we will connect you to the company. Connecting you to the company gives you access to have some correspondences to the company. So that if there are some things that the directors are not doing right, by way of finding out, communicating with the Malaysia, the corporates, at least they will know what we are not doing right here. It will be a form of feedback. Aside of that, once you have been connected, that first registration, and you receive product worth the amount you have paid, I want to announce to you that subsequent product that you are going to be getting, it must be coming to you at the company's discounted price. Nobody is reselling to you. That is when it is guaranteed that you are getting this product from the genuine source. And many other things will follow. We are eagerly waiting for the foundation of the company to come to Nigeria. We are eagerly waiting. And it's you and I that will make it to happen soonest. Once the company's foundation comes into the country, it is going to help to reduce the cost of those who are already on the therapy. You know, our therapy, depending on the case at hand, look at the one that is before us now, like Hernia. He said, if you read it now, the dosage of STC30 and SRC, morning and night, it says between 24 weeks to 36 weeks. You know what it means? 24 weeks to 36 weeks. Of course, you must start seeing a very significant improvement. Within 24 hours, you start using it. 1 week, 2 weeks, 3 weeks, and there are some review that will be going on. The feedback that you'll be giving to the consultant. So please, this company is so passionate over our well-being. And don't use yourself to shoot yourself on your leg by way of cutting corners, by way of selling cheaper. We are talking about life now here. We are talking about life, please. So be guided. Then there are many other things that will be happening even in our small Nigerian team before even the company foundation will come. And that's why we are talking about 80-20 golden rule. By the time you will operate in that capacity, you will see that from the system, you will begin to generate enough bonuses that not only that will help you to get the one that you and your family is taking, but you might even have extra change for other things. Other lifestyle we are talking about, like international trip, is a lifestyle. I can assure you, if you are committed in this with us, in the next 6 months to 12 months, you will see yourself in the other side of life, where life is indeed super. So I want to give room for questions, please. If there is any question in the chat room, and I know that all our medical experts, Dr. Rove, who is the main frontier of this meeting, and Famachilaka, and Samson, please, can you check the chat room and coordinate it, please? Coach Samson, are you there? So please, our package prices are so obvious. It's something that we can forward to you. There's no any hanky-panky once you want to identify with us. We'll give you the price as directly from the company. So don't entertain fear on that side. So, Coach Samson, are you there?
Yes, sir.
Do we have any check the chat room, please? So that
I have a question. Doctor, what can lead to swelling at the spinal cord or shoulder region? Could there be hernia there?
Hello?
Doctor?
Hello?
Yes. Can I go ahead and answer that question?
Yes, sir.
Thank you to the person that sent in that question. As a matter of fact, there's a particular type of hernia that can